Does Medicaid cover naturopathic doctors? If you're considering naturopathic care and wondering if Medicaid will cover your visits, you're not alone. Let's break down the details to help you understand the current state of Medicaid coverage for naturopathic doctors. First, it's important to know that Medicaid coverage varies significantly from state to state. As of 2022, only a few states include naturopathic doctors in their Medicaid programs. Specifically, Medicaid in 6 states covers services provided by naturopathic doctors, but the scope of coverage can differ greatly. For instance, states like Vermont, Oregon, and Washington allow naturopathic doctors to be part of the Medicaid system, which means patients in these states can receive coverage for their services. However, even in these states, the types of services that are covered can vary. In Arizona, for example, Medicaid only covers naturopathic services for minors, not for adults. To give you a clearer picture, if you live in one of the states that does cover naturopathic care under Medicaid, you might still need to check what specific services are included. This could range from routine checkups to lab tests and even some prescription medications, depending on the state's regulations. It's also worth noting that while some states provide Medicaid coverage, Medicare, which is governed at the federal level, does not recognize naturopathic doctors as eligible providers. This means that if you are aging into Medicare or are already a Medicare recipient, you would not be covered for naturopathic services under this program. If you're unsure about whether your Medicaid plan covers naturopathic services, it's best to contact your state's Medicaid authority or your health insurance provider directly. They can provide you with the most current and detailed information regarding what is covered and what is not. In summary, while some states do offer Medicaid coverage for naturopathic doctors, it is not a universal policy and varies widely. Always check with your local authorities and insurance provider to understand the specifics of your coverage.